I would very much like to hand over to our first speaker, Marguerite McLaughlin, CEO of Metro and one of the original founders of the summit.
Good morning, everyone, and welcome to the Garden of England. As the CEO of the Metro and as one of the founder members of the UK LGBT Health Summit, it is an honour and a privilege to welcome you all to the 7th Annual LGBT Health Summit. From the atmosphere and the energy that you are already generating, and from the lineup of workshops and presentations planned for the next 2 days, I can feel that it is going to be a very exciting event. The original ethos of the LGBT Health Summit remains in place. It is a free conference held in different locations each year, and this year there's a successful balance between Kent and Medway and a wider national context, with first results of the Metro's Youth Chances research. This is the biggest ever summit, made up of individuals, all of us, who use health and social care services, as well as activists and members of emerging new organizations and communities, and a particular big welcome to representatives from our intersex community, service providers from statutory, third sector and commercial sectors, commissioners, academics and policymakers. This year's carefully woven threads of themes are isolation, integration, and impact. And you will see these themes genuinely reflected throughout the program, and particularly in the plenaries, happily with many vibrant, emerging voices in LGBT work. A lifetime of experience is being featured in this event, since there is also a special focus on younger and older LGBT people. There are sessions focused on lesbians, gay men, bisexual people, as well as special reference to people living with HIV and to trans people. The quality of the program reflects the dynamic and truly collaborative Summit Consortium that has been in existence for the past 12 months. I've found myself wondering what they're going to do with their spare time after the event ends. I'm really thrilled with the variety on offer in the program. And just look at the diversity in this room, all of us here, to share information and experience and views together on issues so close to our hearts and so essential to so many of our lives. Having set the scene a bit, it's my privilege now to introduce the Lord Mayor of Canterbury to formally open proceedings, Councillor Robert Waters.
Good morning, distinguished guests, ladies and gentlemen. On behalf of Canterbury City Council, it gives me great pleasure to welcome all summit delegates to the city. We are delighted that Canterbury has been chosen to host this national summit. I am sure you will be well looked after here at the university and that your stay will be both comfortable and profitable. The Council has lent its support to this summit in order to promote it to as wide an audience as possible and to show its ongoing support for the LGBT community. The Council fully supports the work to develop improved health and well-being outcomes. I therefore hope you all enjoy your time in Canterbury and, more importantly, the summit. that you find the next couple of days to be informative and engaging. I wish the summit every success and declare it open. Thank you.
Thank you. I'd now like to introduce our next speaker, which is Dr. Karen White, the Executive Medical Director for Kent and Medway NHS and Social Care Partnership Trust.
Thank you, Beth. I'm very pleased to welcome all of you here to Kent, to sunny Kent, for which we're very grateful, on behalf of all Kent and Medway NHS organisations, but most particularly on behalf of my own organisation, the Kent and Medway NHS and Social Care Partnership Trust, but also on behalf of my colleagues from the Kent Community Health NHS Trust. We provide mental health services to the whole of Kent and Medway, and as Beth said, I'm the Executive Medical Director of that trust, a member of the Trust Board, and long-time out lesbian of this parish. We've been honoured to be steering group partners in developing this conference, and I want to thank the Metro Centre for allowing us to be involved and facilitating our contribution. Colleagues from the Kent Community Health NHS Trust have actually been full consortium members working to develop this event, and a number of colleagues from the Trust are here, and you'll be hearing about their work this morning and over the next few days. And having been asked to be part of the welcome to all of you, I'm actually going to take a few minutes to talk about the mental health issues that LGBT people face, and to try and locate mental health at the forefront of your thinking as participants in this summit from the very beginning. About the mental health of LGBT people. Well, what we do know should give us all pause for thought and reflection throughout the next 2 days of this summit. We know from a number of studies in the UK and around the world that depression, anxiety, attempted suicide are all more common for LGBT people than other people in the population. They're probably at least 1.5 times more common for LGBT people, and that is probably an underestimate. Older LGBT people often have their health needs overlooked in all sorts of ways, but most particularly in mental health. They are frequently assumed to be heterosexual. They may be particularly fearful about seeking help for their mental health problems because, of course, they may have lived through times when being gay was not only illegal, but was diagnosed as a mental illness. And even though I'm not one of the psychiatrists who lived through that generation, I still feel the need to apologise for that to my fellow LGBT people. Here in East Kent, the East Kent LGBT Mental Health and Wellbeing Network, a grassroots group made up of service users, service providers such as staff from my own organisation and other community members, has worked with the Metro Centre to look at the mental health and mental health needs of LGBT people in East Kent and try to understand how services are or are not meeting those needs. The report makes a number of recommendations that we are working on, including thinking through the viability of specific services for LGBT people. But actually, it reminds us that still we don't really know how many LGBT people are using our services, because many still don't have the confidence in us to reveal their sexual orientation. for the next 2 days for this fantastic health summit is that we will all learn new ways of tackling the isolation that LGBT people still face in our communities. And most particularly, that all of us who work in the NHS can use that learning to improve the experience of our fellow LGBT community members, those who use our services. So enjoy the summit. It's going to be a very lively and exciting time. Thank you very much.